I'm Russ McLean, Chairman of the Patient Voices Group. It's Monday the 24th of October, and today I'm in conversation with the Chief Executive of East Lancashire Hospitals Trust, Mr. Kevin McGee. Kevin, hello.
Good morning, Russ.
I'd like to start, if I may, with Burnley General Hospital and the news perhaps that it's to become a teaching hospital. So how will this be good for patients and the local health economy? And talk to me about the new elective surgery unit.
So both the Burnley site and the Blackburn site, historically we've done a lot of training for medical staff, for nursing staff, and we felt that was appropriate to recognise that in the names of the hospital. So in both the Burnley and Blackburn site, we're going to incorporate the name teaching into the hospitals. I think it's really important because when we think about attracting staff for the future, we want the best and the brightest clinical staff of all descriptions to work within East Lancashire, within our hospitals, and to look after our communities. And the fact that it's got a teaching component to those hospitals will make it more attractive in terms of attracting those best staff. So this is really important for us. I think it's a great step forward and it's a really positive move for both hospitals.
Staying in Burnley, another month and another investment. At a time when commissioners are pulling in the reins, so to speak, why are you sort of spending money on resources at new ventures in East Lancashire? I mean, for instance, you've opened a new section to the Rehabilitation Centre. Let's talk about that in particular. How will this aid the recovery of patients?
So in spite of the financial pressures that the NHS is under, it's still important that we develop services and we look to have the best services that we can. And we're doing a number of really exciting, important developments on the Blackburn and the Burnley site. But if you take the Burnley site in particular, we've invested in a new day case unit. What we want to do is to put more day case activity through the Burnley site, ring fence this capacity and make it a real centre of excellence, not just for local residents but for all over Lancashire, and really beef up the reputation. We're also still continuing with the work in terms of the new ophthalmology bill, which is an 18 million investment on that site. And in terms of Rakehead, we've just completely revamped. There's a part of that building which is used for it's basically a flat where patients, as part of their treatment and rehab, can go and live in a degree of isolation but also linked to the unit where they can get the care if they want to. And it's really a step to moving them back into sort of normal life. So we put a lot of money into this, into the upgrade in the flat, and if you go in there now, it was opened a couple of weeks ago by our chairman, it's a really state-of-the-art facility.
I think what a lot of people are getting at is that we seem to be sort of in this, the NHS is in dire straits regards finances, and yet East Lancs Hospital Trust every week seems to announce the fact that it's pumping more money into resources. Where's the money coming from?
So we are financially constrained and we have to look at every pound that we spend, but we have a budget of nearly £500 million, and what we have to do is make sure we use that money appropriately. So there's still vast amounts of money coming into East Lancashire to support health and social care. What we need to do is use that appropriately, and there are areas where we can develop and look to improve services, and I don't make any apology for that. Our communities and our population deserve the best possible care they can get, and that's what this investment's about.
It's with sadness really that I have to report to you that during my travels around the trust, that B word seems to be rearing its ugly head again, with some staff reporting that they're being bullied and that you seem unaware of what's really happening in your departments. So staff across the trust tell me that their concerns are brushed away, and that although they are aware of your whistleblowing policies, they feel neither confident or supported when they raise concerns to managers and are labelled as troublemakers. So Kevin, how confident are you that middle management are truly reporting everything up to you? And wouldn't you agree with me that this is where your predecessor came unstuck, in that he didn't really have his finger on the pulse of what was happening? And coincidentally, one of the reasons that this trust was placed in special measures. How confident are you that you are being kept in the loop?
So I am sure in an organisation this size, where we have nearly 8,000 staff, there are things that I don't know about all the time. But let me just be really clear, bullying of any form is not acceptable. It's not the culture of this organisation. It's not a culture that I would support, and anything and any time I know about bullying and there's evidence, I will deal with it, and I will make sure that people in the organisation deal with it. we've done an awful lot of good work in terms of trying to support staff. We have a lot of emphasis on staff health and well-being, and we also we've just implemented a new staff guardian. So there's lots of ways that staff can report bullying and do it anonymously, and those things can be investigated and pushed back through. I think it's really difficult in the NHS at present. I mean, the NHS is under a lot of pressure. We have pressures in terms of funding. We have more people that we need to see who wish to access our services, and there's lots of pressures in terms of our, the support agencies around social care, etc., which means there's more pressure in terms of the NHS, which puts more pressure on our staff. So I do accept that the NHS nationally and East Lancs is under pressure, and staff feel that pressure, and we are working day in, day out to try and support staff the best we can. All I can say is that if there is bullying going on in this organisation and staff want to tell me about it because they don't think it's being dealt with, tell me anonymously, or tell me if you would like through some means that you feel comfortable with, because I will deal with it.
I'd like to speak now about your Employee of the Month, which actually is a fantastic way of promoting and making staff aware that they're valued in the organisation. But a couple of people have said to me that their perception is that all grades of staff aren't being rewarded equitably. What would you say to those people?
I would say that we employ around about 8,000 staff, and virtually every one of those staff is worthy of Employee of the Month. So it's really difficult in terms of how do you differentiate between staff and how do you award staff. And what I want to say to staff is that every one of them, no matter where they work, no matter what they do, their work is absolutely valued because we're all part of a team. When I award most of the Employees of the Month, and if I can't, one of my other senior directors do it. And what I see is actually a real spread right the way across all of the disciplines, clinical and non-clinical, managerial staff, frontline staff, and I think there's a real spectrum of people who are awarded, and I think that's great because it is meant to reward anybody who works and goes that extra mile in the organisation. And also bear in mind, what we do is staff nominate their colleagues, so it's up to staff. If they think somebody is deserving of Employee of the Month, it's up to staff to nominate their colleagues. So I would actually say to staff, if you think people aren't being rewarded and not being recognised, send in an award, send in a request.
Nigel Evans, MP, who represents Cerebral Valley, is amongst several MPs who are trying to push through government an opt-out scheme for organ donors. So this would mean that everyone is automatically an organ donor unless they opt out. So what are the figures for your trust, if you know, and are there many people that will perhaps pass away waiting for an organ and transplant surgery?
I don't know the figures directly for East Lancs Hospitals Trust, but what I do know is nationally, and we will be no different. In all hospitals, there are people who are waiting for organ donations. It is something that I think is clearly it's very difficult to talk about, but it's something that we do need to talk about, and it's something that we do need to encourage. So I would support the work that the MPs and the publicity the MPs are trying to push forward. It is something that we take very seriously within East Lancashire Hospitals Trust. We do have those very difficult and sensitive conversations with families, and it is something we try and push, but we do it in a very sensitive way.
We're in the throes of the flu season. How does the Trust encourage its workforce to take up the flu vaccination? Tell me how you are making a difference. I've seen the press around mothers and their children a world away in Africa.
Yes, so last year we were the Trust that had the highest percentage of staff of any NHS organisation in the country who were vaccinated. It was just over 82%. This year we're looking to achieve 85%. It's something that we just keep continually pushing. And for every vaccination that we have now, we're donating vaccine to Africa, and it's just something that's really important for our staff to do, because clearly as we go into winter and the NHS is under pressure, we need our staff here working fit and healthy. One of the ways they can keep themselves fit and healthy is to have the flu vaccination, and we do everything we can to make it convenient and easy for staff to get that vaccination. And our figures this year are looking good. and I'm hopeful that we can achieve 85% of all staff, regardless of where they work in the organisation, being vaccinated.
There's a lot of chatter, as usual, across East Lancashire about East Lancs Hospital Trust poaching GPs from the local health economy. How would you answer your critics?
So I find this really interesting, because what we're trying to do is to provide the best services that we possibly can to our population, and all health professionals should be working together. So we are looking to work very strongly with primary care, to link primary care, secondary care, community services, so that we can provide those best, that we can provide the services the best we possibly can to our communities. We've had a long history of GPs working within particularly our urgent care centres, and that's something that we would encourage and something that we're trying to work with going forward. We're also trying to attract and support primary care by trying to attract new primary care professionals from outside East Lancashire into East Lancashire to work in the hospital and to work in primary care. And we're doing some great work with some of the federations and some GP practices to try and support that. So I don't think that we're doing anything that it could be called poaching. In actual fact, we're trying to work very closely with primary care and support primary care.
I'd like to talk to you now about locum GP fees. We all know that doctors' fees in secondary care are capped, and the government has just introduced a third tranche of those. Can you tell me, is there a plan? Are you working with local GPs and locums, in fact, to pay over the approved hourly rate?
So I don't know what hourly rate gets paid in terms of primary care. Some of those are commercial deals that are the CCGs and other agencies are responsible for. What I do know is that we are very responsible in terms of the rates that we would pay for primary care and for GPs, and we have to make it sure it's consistent with what we're paying our own internal consultant staff, and also we're not looking to destabilise primary care by paying over the odds. So we are looking to pay a competitive rate, but we're not looking to pay over the odds.
I think this question has come from a single-handed GP, and he's worried that the hourly rate that he's having to pay locum GPs is literally going to cripple him.
And I think that this goes to a wider issue in terms of how can we work differently in East Lancashire going forward. I do recognise that it's very, very difficult for small single-handed GPs to manage the pressures that are on primary care now. And so what we're trying to do is, and we're doing some great work both in Clitheroe and Rossendale, and if this works, looking to roll it out across the country, to really develop what we call integrated neighbourhood teams, where you get primary care working with community services, working with social care, and working with other agencies, but also getting hospital consultants reaching out and supporting local communities and providing services in local communities. And these integrated neighbourhood teams are really looking at the population of those local communities and targeting those local communities to work with them. And so that, the days of having a single-handed GP trying to manage things on their own, I think should be gone, and we need to move away from that and really focus on these teams of professionals working together.
I'd like to talk about federations. Is there any truth to rumours that East Lancs Hospital Trust has aligned itself with some local GP federations to bid for services, and that these federations and the GPs are more interested in perhaps making money than taking care of patients?
So we are here to serve our communities, and we will do whatever is right to serve our communities. I think the days where you had the artificial boundaries between primary care and community care and secondary care are gone and need to be washed away completely. And what we need is services delivered in the best way, breaking down the boundaries between the various professionals and everybody working together. So we would work absolutely in conjunction with primary care, with federations to improve and deliver services. We would work directly with GP practices to improve services, and I make no apology whatsoever for that. That's exactly the right thing to do. We need to improve the services that we deliver for our communities, and I will do everything that we need to do that in terms of breaking down those barriers.
Do you think there is a future then for primary care, and Do you think that future of primary care lies best with, as you said, a collaborative effort between it and secondary care? And how is this going to benefit patients in the long run?
Primary care is the bedrock of health delivery in the United Kingdom, and I think will always be the case, and we should be really, really proud of primary care. There's not many other places in the world that has the strength of primary care that we have. But that doesn't mean it doesn't need to change, as the hospital services need to change. And the future, as I've said, is all about breaking down the barriers so that, this thing about having groups of professionals working together in community settings, be they GPs, community staff, social workers, hospital consultants, working in local communities, targeting and supporting local services, is the right thing to do. We talk about the hospitals now as being hospitals without walls. We've got to get away from the fact that people had to come into hospital to have the services. If we can keep people fit and safe and well in their own homes and communities, that has to be the way for the future, and only when it's absolutely necessary should they then come into a hospital bed. The way we keep them in the communities is, as I said, breaking down the barriers between community care, primary care, social care, hospital services, and really focusing services in those communities and joining things up.
Do you think that you will ever break down those barriers? Because there's always been a sort of mentality, hasn't there, about them and us?
I think that we're at a real tipping point, and I think the pressures on the workforce, the pressures in terms of money, the expectations of our communities are such that the NHS will change significantly over the coming years, and it needs to meet the needs of our communities.
A&E, I'd like to talk about that now, and unfortunately you're failing A&E figures. So in August they were the worst of 2016 at 77.9%. During the summer there were 7 recorded 12-hour trolley waits, and this figure rose to 9 during August. I'd like to make you aware that patients obviously are not happy about that. There shouldn't be anybody waiting on a trolley in a corridor. So what's going on?
So this really is a continuation of what I've been talking about. We need to look differently in terms of how we deliver services for our communities. So if you look at our A&E performance, this is happening everywhere in the country. What we're getting is are too many people trying to access A&E services with not enough staff. So what we need to do is to manage people in their homes and in their community settings better, so they don't need A&E attendances. What we then need to do is have the right staff in A&E and urgent care, and that is a combination of both GPs and hospital consultants working together and working differently. And we are working incredibly hard to try and improve our performance. It has improved over the last month, and so our figures have picked up, but this will be a continual problem for every NHS organisation in the country, because the biggest problem that we face now is not actually about money, it's actually about staff. So if I had millions of pounds more today, I probably wouldn't be able to appoint the doctors and nurses that are needed because they're just not there. So what we have to do is to work differently, keep people in their own homes, work differently with primary care, and that way take the pressure off hospital services. And I would really, really encourage anybody who's listening to this to think really strongly about whether you need to come into A&E or urgent care. Think about the other options. So think about 111, really try and access primary care, think about pharmacists, think about home care. Really only come into your A&E department or urgent care if it's absolutely necessary.
I know you're heading up a board to particularly look at tackling A&E, and there was a lot of press around you turning this around in 90 days.
So where we are in terms of our performance, every trust in the country is struggling. We're about mid-table now, if you want to be blunt, in terms of performance. So, we're not talking, that's not what it's about. This is about the NHS working together with all agencies to try and improve and support performance. This is not about, heavy-handedness from the regulatory authorities. Actually, they've been very supportive. They want to see improvement, but they want to see the dial improved, they want to see performance improved. So we've got some really good action plans that we're putting in place. We're starting to see improvement, but this is not something that will change dramatically overnight, because ultimately there's lots of workforce issues, and we then need to change the behaviour of some of our communities about people only accessing services when necessary.
Let's talk about that just a moment. How are we going to achieve that, changing the way that members of the public and patients access services? How are we going to achieve that?
I think there's two things. So firstly, we have to make sure the services are right in the community for people to access, and that's what we're trying to do in terms of the integrated neighbourhood teams I've been talking about. But then we also need to educate people so that they feel confident that they don't need to attend A&E. So it's a combination of communication, education, but also putting the right services in community settings.
Now, I was outside your A&E on Saturday night, and there were 6 ambulances there, so obviously there was a problem. I have read in the press recently, and Damien Riley, your medical director, has said that a lot of the problems are stemming from mental health or people with mental ill health. How on earth are we going to tackle that, Kevin?
So 6 ambulances on a Saturday night is actually a quiet Saturday then. It normally gets up into the teens. We are seeing more and more people presenting through A&E with both physical and mental health problems, and that is something that, I think our numbers have increased by about 25% over the last 6 months. So this is a real issue for us. I don't think there's any easy answer. We're working very hard with other providers such as Lancashire Care Foundation Trust, who provide mental health services across Lancashire, and we're working together really well to try and support people who come into A&E with both physical and mental health problems. There's a piece of work going on across Lancashire to look at the capacity for mental health patients. Have we got enough beds and support in the system? And our CCGs are leading that piece of work. I wish there was an easy answer to it. There isn't. We just need to work very hard. We need to look to see that we've got the right number of beds, the right number of staff to cope with patients with mental health needs across the patch. But it's not easy.
Would you say, and perhaps you aren't able to say, that the reason that there are a lot of people presenting at your A&E with mental health problems is because there has been a significant reduction in the number of mental health beds, not just across East Lancashire, but nationally?
I think there has been a reduction in capacity on a national basis. What I do know now is that there is a lot of emphasis, both locally and nationally, going into what we call parity of esteem, which is to try and provide care that's equal to somebody having a physical health need. So a lot of thinking and a lot of support and investment is going into beefing up and supporting mental health services, and that's absolutely right.
Kevin, I'd like to close our little session today with an optimistic note. Personally, you've been nominated by the Health Services Journal as Chief Executive of the Year. How did this come about? And more importantly, when will you hear whether or not you've been successful?
The nomination came from members of staff. I had nothing to do with it. At one level, I'm slightly embarrassed by it, but at another level, I'm sort of really pleased that some members of staff would feel it's appropriate to nominate me. The award will be later in November. I'm up against some very strong candidates on a national basis, but even just to be recognised and to be nominated is great, because I think it's a reflection of the work that we're doing in East Lancs Hospitals Trust, and it reflects upon the great work that every member of staff does. So, to be nominated, I'm not being nominated for myself. I'm being nominated for the trust and its staff. And if I were to win the award, it would be on behalf of every member of staff of East Lancs Hospitals Trust and wider. It would represent the work that we're doing with partner agencies and our CCGs, with social care, with other providers, because we're all in this together.
Kevin, I'd like to wish you and the Trust well. Thanks very much for talking to us today.
Thank you.